Hello and welcome to the Breastfeeding Conclave of 2021. The global theme for Breastfeeding Week this year is protecting breastfeeding, and the focus is on on sharing the responsibility of breastfeeding and not just leaving it onto the woman. And that is what Thanks to Voice of Healthcare, we have this wonderful Breastfeeding Week being organized. And I'm your host for this session, with a very eminent guest. But before we get there, I'd like to take this opportunity to thank MCure Pharmaceuticals to sponsor the event. And thanks to them, this is actually being possible. Very quick introduction to who I am. My name is Rashmi Pucha. I am the founder of Ainari. Ainari is a women's health platform, and we focus on healing hormones naturally, via diet and fasting. So, women's health is a very close, topic for me. Menstrual cycles and breastfeeding, unfortunately, are topics which are not being spoken about openly because of taboos, cultural taboos in the society. And I'm very, very excited to be here today and talking to a very eminent person on this topic. And with that, I'd like to introduce our speaker for today. She's a very, like I said, a very well-known gynecologist and a laparoscopic surgeon. She's also the president of the Federation of Obstetric and Gynecological Society of India. Please join me in welcoming Dr. Shantha Kumari. Welcome to the show, Dr. Shantha. It's a pleasure to have you here. And we would love to know a little bit more about you. So if you could just share a little bit more, I think it'll be really, really nice.
Thank you, Rashmi. Hello, everyone. I am Dr. Shantha Kumari. I'm from Hyderabad. I'm the president of FOXY. FOXY is the Federation of Obstetrics and Gynecological Societies of India. We are a 37,000 strong body of gynecologists. And we have about 262 societies in the countries across the length and breadth of the country. All of them are our members. And our commitment is to women's health. And this year, the FOXY theme in my presidency is FOXY for all, always, and Dhira, stop violence against women. Now, what do you mean by saying FOXY for all, always? See, FOXY for every mother to be able to save herself, to reduce the preventable maternal morbidity and mortality so that we can reach the SDG goals. FOXY for every mother so that she will be able to breastfeed her child so that the baby will be healthy and grow up to a strong adult. FOXY for all FOXians so that we can practice with protocols and with dignity. And we would be able to take forward the right messages to our patients. And of course, FOXY for every woman with Dhira, which is an initiative to say no to violence against women. So friends, with this theme of FOXY for all, always, we have come this year. And that's how we are here today with Rashmi to talk about the Breastfeeding Awareness Week. You all must be knowing about this World Breastfeeding Awareness Week.
Yes, ma'am. And with that, I think we're going to jump to some questions because I know you're tight on time, and I'm sure our audience is also waiting for the questions to kind of get answers from you on so many issues. So the first question, why do you think it's important to recognize breastfeeding and facilitating its importance, especially in the Indian context?
Yeah, that's a very interesting question, Rashmi. In fact, why are we talking is because the World Breastfeeding Week is celebrated every year from the 1st to the 7th of August. And that's the reason we are here to just discuss about everything about breastfeeding. Ironically, actually, we are talking about breastfeeding. In fact, when you look at human beings are the only, I think, live beings on the earth who are actually looking at something other than breastfeeding. We don't find any other living organism on the face of earth who will try to feed the baby with any other feed, right? So I think that is the reason why now we have to focus on what is a normal physiological aspect. So that is the reason we decided that it's time that we talk about breastfeeding. And this year, as you rightly mentioned, the theme is Protect Breastfeeding, a Shared Responsibility. So this is the theme of the year, and that's the reason we got together to talk about this breastfeeding and to bring about more awareness among the new moms who are going to take care of their babies.
Fantastic. I think you said it. I think we are the only species on this planet who are so reluctant to talk about it, who are looking at other options. And we're so glad that organizations like Foxy actually take up some of these causes. So, Dr. Shanta, how do you think associations like Foxy, how do they play a role in educating and empowering the practice of breastfeeding at large? And I'd like to add just one more question to this one. Are there any specific policies or programs that have been or are being initiated by Foxy to address the importance of on this issue?
Yeah. Thank you, Rashmi. We at Foxy at the national level, we have some committees. We have about 27 committees which work under the Foxy leadership. And one of the committees is the Foxy Breast Committee. This committee actually works towards enhancing the breastfeeding practices in the country and trying to raise the awareness among our patients and women and the society at large. So this is an ongoing project. Over the decades, we have been having this committee, which has been led by able Foxy members, and they actually work at the all the society levels and try to increase the awareness of breastfeeding. And we as an organization, for us now, we are looking at this breastfeeding week, 1st to 7th August. So what we have done is we are doing the progress program of Lactation 2021, and which will go to culminate in a program on Lactocon on the 7th of August. So the week-long celebrations, we have actually called all our societies to participate in this week-long programs. And we have requested the president secretaries in the all our 262 societies to come forward and tell the members to participate in various public awareness campaigns. They can do it at their clinics, at their hospitals, or they can do in outside on the digital platform. They can do media shows. They can do write-ups in the newspapers, television shows. Every possible medium, to connect to the general public. That shows the commitment of Foxians towards women's health and breastfeeding. That is our responsibility. So when you're talking about protect breastfeeding, that means it is something which every one of us has to nurture, the
Yeah,
breastfeeding. And why are we saying it's a shared responsibility? It is not only the responsibility of the mother towards her baby, but it is the responsibility of the family as a whole. And the responsibility of every doctor, every healthcare provider, be it a NM or a nurse or a midwife, whoever is taking care of the mother during the pregnancy and delivery. And along with them is the responsibility of each and every one of us in the society. If a
absolutely.
mother is going somewhere with a baby, any place, any public place or any other place, she should be given some space where she will have the privacy to feed the baby, where she'll be able to take care of the baby's need. So that is where the society's responsibility comes. And to show and reinforce that it is everyone's responsibility to see that every baby has the right to the breastfeeding and breast milk, which is the best milk.
That's very beautifully said. I think I so agree. As a woman, of course, my daughter is 14 now, but I've gone through it, and it's been, let's say, it's not been a very comfortable journey so many times, right? And especially in public places, at workplaces, it does
Yes.
become challenging. Dr. Shanta, I have one question. I had asked you earlier as well. At the policy level, are there any influences that are being made by organizations such as yours? Is it
Yes.
are you doing something? Yeah.
We have our policy where we say that we encourage breastfeeding. That's the reason we are doing this celebration. And then we expect all our members, Foxians, the 37,000 plus obstetricians, gynecologists, to partner with us to encourage this breastfeeding. And when you look at the government, then you look at the UNICEF and so many organizations who are working towards this enhancing the breastfeeding. And when you look at the data, it is rather not very nice, to notice that when you look at the South Asian countries, India is having only 44% of women who are actually initiating breastfeeding within 1 hour of the birth of the baby. So we are
Oh, wow.
lagging behind. So we want to encourage it. We want to increase the number to the maximum so that every mother will initiate breastfeeding within 1 hour of the birth of the baby. So that
Yeah.
will go in a long way to establish faster breastfeeding and then the what the baby needs. So
Of
that's
course.
what we are encouraging.
Nice. Asking you a question, a follow-up question on what you just said. So, if only 40% are breastfeeding within the first hour, what do you think is the main reason why the remaining are unable to do it or not choosing not to do it for that matter? Would love to
See,
understand this. Yeah.
we are talking about the initiation of first hour. It doesn't mean that the rest 56% are not breastfeeding. It is the start initiation of breastfeeding, which is
Ah,
delayed. Okay. So
correct.
that you have to get me right. And then there are so many myths, some people have the feeling that the first milk, which is that colostrum, we call it, that's
Yeah.
not good. It's thick and the baby cannot digest. These are some myths and fancies which women hear from the neighbors and all the people whom they ought not to hear from. So these are the myths, and sometimes, say the baby is born, if the mother had an operative delivery, the mother is very tired, or or sometimes if the baby had some other issues. So those could be some of the reasons why the delay in breastfeeding. So we encourage all the obstetricians and all the neonatologists and pediatricians who are attending the deliveries to see that the initiation of breastfeeding is as soon as possible, even if it is an operative delivery.
I think that's a fantastic point that you mentioned because I had not understood it, from a layman's perspective. I think it makes things so much clearer. Um, is there any message that you'd like to give to parents, reinforcing what you just said, that why it's so important to do it in the first hour and even beyond that? Because we still, unfortunately, it's not as like every baby, like you said, should be able to, get that milk, right? It's gold. And is
Yeah.
there any message that you'd like to share with the parents?
Yes. What is it is not something which is beneficial to the baby. As soon as the baby starts breastfeeding, the suckling reflex will cause the release of oxytocin hormone, and
Yes.
this hormone will act on the uterus and make it contract. So that will prevent the excessive bleeding after delivery. So you all must have heard about postpartum hemorrhage. That is a dreadful condition which is one of the leading causes of maternal mortality and morbidity in our country. So early initiation of breastfeeding will also reduce the amount of blood loss. And not only that, what will happen is the breastfeeding will reduce the amount of blood loss, and anemia, which is so rampant in our country, that also gets reduced. So that is
Lovely.
also one of the important aspects uh, for us to actually initiate breastfeeding as soon as possible.
Fantastic. Ma'am, last question. Do you think events or discussions like these actually contribute, to the international drive of, breastfeeding awareness? Or is it something which lasts for that 1 week and then I understand that
Uh,
organizations such as yours do it, I get that. But in terms of, how it's spoken about in public places, in terms of just general awareness about talking about it more than like
yes.
not knowing about it. So how do you think, what's your take on that one?
Rashmi, what I have observed every year, this World Breastfeeding Week is being organized, and then so many programs are going on. But this year, I have seen a renewed interest, more interest from various partners. We have seen all the stakeholders of women's health, all the NGOs, all the lot of mothers groups, and lot of other partners. They're all very keen to actually increase this message, and to
Yeah.
see that more number of babies are, or I would say all babies should be breastfed. That's their right. And
Yes.
not, we do understand that the breastfeeding is the one way that the first few days milk has lot of antibodies along with the nutritive value. And these antibodies, it's like, the first vaccine the baby receives. Now, the
Yes.
past 1 year, everyone has been talking about immunity, vaccines, and then infections. So I think no better time than this for us to emphasize on the need of breastfeeding for babies. That's the reason why we need to focus on breastfeeding.
Absolutely. And I think, like you said, immunity is something that everyone's been talking about in the last 1 year, and antibody release, immunity, gut microbiome itself, right? I mean, there's so much positivity to breastfeeding. And I'm very glad to be able to, have spoken with you and had the opportunity to actually, ask these questions on behalf of our audience. And I have no further questions. If there's anything that you'd like to,
Yeah,
yeah,
I would like to add one thing.
please go ahead.
Every mother and father expect that the baby to be the most intelligent baby on the earth. And so, for those moms and dads, I would like to tell there are some studies which have shown that the breastfed babies are more intelligent than the non breastfed babies. So, if you want your baby to be more stronger, and they're actually less chance of infection, less chance of hypertension, less chance of obesity, less chance of lot of cardiac diseases when they grow up. So, if you want your baby to grow up to be a very intelligent adult with absolutely no health problems, then it's your responsibility that you breastfeed your baby. So, this
This
is
is
my
wonderful.
message.
Oh, this is a wonderful message. I think that will reinforce all the IIT, IIM exams that we want to write, at the end of
Yes.
at the end of many, many years. Thank you so much, ma'am. It was lovely speaking with you. And with that, I'd just on a parting note, thank you so much to Voice of Healthcare for organizing this. And once again, to the sponsors, MCure Pharmaceuticals. It was lovely having you all. And if there are any questions, please go ahead and post them in the comments, and we'll make sure to respond back to them. Thank you.
Okay.